Have you ever noticed clots in your period and found yourself wondering if that's normal? Don't worry, you're not alone. Menstrual clots are more common than you might think, but understanding them is key to knowing what's normal and what might need attention. In today's video, we're breaking down everything you need to know about menstrual clots. We'll cover what period clots are, why they form, when you should see a doctor, and how to treat or manage them effectively. If you've been curious or concerned about what's happening during your period, stick around. By the end of this video, you'll know how to tell the difference between normal clots and potential warning signs. Let's dive in. What are menstrual clots? Menstrual clots are jelly-like blobs of blood mixed with tissue that are passed during your period. These clots are formed when your body's natural clotting mechanism works to control heavy bleeding. They can vary in size, ranging from very small clots to those as large as a quarter. To better understand, think of your period as your body's way of shedding the uterine lining, which has built up throughout your menstrual cycle. This process involves blood, tissue, and mucus leaving the uterus. When the flow is heavy, the blood pools in the uterus or vagina, giving it time to thicken and form clots. Visual aids like animations or diagrams can show how the uterine lining sheds and why clots form. For example, imagine blood flowing smoothly during lighter days, while on heavier flow days, it slows down and forms thicker patches, creating clots. How menstrual clots form. Clots are a natural part of your period and form due to your body's natural clotting mechanism, which is designed to prevent excessive blood loss. When your uterine lining breaks down, it mixes with blood and flows out of your body. During heavy flow, blood accumulates faster than your body can thin it, giving clots time to form. The likelihood of clotting increases when you've been sitting or lying down for a while. When you stand up, gravity helps the pooled blood pass quickly, often appearing as clots. Occasional small clots are completely normal, especially during the first couple of heavy days in your cycle. However, frequent or very large clots, especially those larger than a quarter, could signal an underlying issue. It's important to differentiate between clots that are a regular part of your cycle and those that may be a sign of a health concern. Hey, if you're liking this so far, make sure to hit that like button. It tells me I'm on the right track and helps others find the video too. And if you're new here, welcome. Click that subscribe button and turn on the bell so you never miss any of the fun. Common causes of menstrual clots. There are two main categories of causes: normal factors and underlying conditions. Normal causes. Heavy flow days are the most common cause of clots. The heavier the flow, the more likely blood is to pool and clot before leaving the body. Sitting or lying down for long periods also contributes. Once you stand up, gravity pushes the pooled blood out, leading to visible clots. Underlying conditions. If clots are frequent, large, or accompanied by other symptoms, they may be linked to uterine fibroids or polyps, non-cancerous growths in the uterus that can lead to heavy bleeding and clotting. Hormonal imbalances. High levels of estrogen or low levels of progesterone can cause the uterine lining to thicken excessively, leading to heavier periods and clots. Endometriosis or adenomyosis. These conditions cause the uterine lining to grow abnormally, often resulting in heavy bleeding and painful periods. Blood clotting disorders. Rare but possible, these disorders can make your blood clot more than usual. Pregnancy-related complications. Conditions like miscarriage or ectopic pregnancy can also cause clotting. When to be concerned. While small clots on heavy flow days are normal, certain signs should prompt you to consult a healthcare provider. Pay attention to the following. Clots that are consistently larger than a quarter. Periods that are extremely heavy, requiring you to change a pad or tampon every hour. Bleeding that lasts longer than 7 days. Accompanying symptoms such as severe pain, dizziness, fatigue, or shortness of breath. If you're experiencing any of these symptoms, don't hesitate to talk to your doctor. It's always better to get a professional opinion and rule out any underlying conditions. Treatment and management options. There are several ways to manage menstrual clots, depending on their cause and severity. Lifestyle changes. Stay hydrated and eat a balanced diet rich in iron to replenish what you may lose during heavy bleeding. Light exercise can improve blood circulation, helping to reduce clotting. Medical treatments. Hormonal therapies such as birth control pills can regulate your cycle and reduce heavy bleeding. If fibroids, polyps, or other conditions are the cause, treatments may include medications or surgical options, depending on their severity. Natural remedies. A warm compress on your lower abdomen can reduce cramps and improve blood flow, which may help prevent clotting. Herbal teas like ginger or chamomile can reduce inflammation and ease discomfort during your period. By understanding the causes and treatments, you'll feel more confident about managing clots and knowing when to seek help. To wrap things up, menstrual clots are often a normal part of your period, especially on heavier flow days. However, knowing the difference between what's typical and what might signal a deeper issue is essential for your health. If you're ever unsure or experience any concerning symptoms, don't hesitate to reach out to a healthcare provider. Taking care of yourself starts with understanding your body. With that said, thanks for watching. Hit that like button, subscribe, and share your thoughts in the comments. And until next time, take care.